Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Dr. Dan Westphal's here in our radio studio. He's a Senior Vice President, Chief Medical Officer at Broward Health. Very big responsibility. When you were growing up as a kid, did you ever know you were going to do this and you're going to be in charge of all these doctors?
I have no idea. No clue whatsoever.
So how did it all happen?
Well, it's kind of interesting. I grew up in a small town in south central Kansas. We had a very small graduating class of 8 people. 8. That's correct. EIGHT, 8 people. So, I was the first one.
How long ago was that?
I don't even want to tell you this. It was after the fossils were discovered, after the dinosaurs. No, but I actually had always, from high school on, wanted to be a physician. And that came out because I had a brother that died before I was born, basically died of medical malpractice.
Really?
So as a result of that, I always said, that if I could help one person, it would be worth going into medicine because I didn't want other people to suffer the same consequences as my brother, who at the time was 9 years old. But to be fair, this was before he had osteomyelitis of his leg, and to be fair, this was before antibiotics. So, although it seems like there could have been a different outcome, we had to be there to really see what truly happened. But I think things could have happened much sooner from what I can recollect. But be that as it may, that's what really led me to go into medicine.
But wait a minute, so now you're in a small community, and how did you get the education to be able to even get into a very good school and to do this?
Well, it's interesting because, I always liked academia, always liked studying. And even though we had a small high school, we had the basic 3 R's, reading, writing, and arithmetic. So, we really got basically good skills, good learning. I went on to college, and that even progressed further. And then from there into medical school. So I think each step has been a step up, a step further, if you would, in the educational process, and, requires diligence. You don't get here because you're just smart. You got to get there because of hard work.
True, but to be a doctor, of course, we know it does take a lot of hard work, and I'm sure your family were really rooting for you. Sounds like you were the first one to go maybe to medical school.
Well, I was the first one to go to college, and
really?
There's only been one other person in our high school in history that ever gone into medicine.
Amazing.
And actually, I had the fortune to meet him I had good fortune to meet him a number of years ago, but that was when I was in medical school. He actually went to work for the CDC in Denver, so he was a physician, ID specialist, infectious disease specialist, and basically an epidemiologist. They traveled all over the world. But no, I was the second to go from the high school to medical school. And, of course, my family was extraordinarily proud, my mother particularly, because my mother had been the one had been the impetus for me to really strive. She said, you can do it. She says, I know you can do it. She says, I don't want you to be stuck in a small town. And she said, you're smart and you need to just work hard. And she always had the faith in me. Always. I think it would be, I was telling someone the other evening, I said, it would just be wonderful if my mother and father were still alive to see, how far I've really come. Not in a bragging way, but just from humble beginnings.
And you have come far. When did your mother pass away? Where did you get by the time that...
Well, I was actually in practice when she passed away. She passed away in a nursing home in the Midwest in Kansas, and I was actually talking about this yesterday in 2008.
So she knew already that
you
reached
she did.
the place that you had hoped to be. And so has it disappointed you? Have you always been thrilled that you did this?
Oh, absolutely. I've never looked back. I always look to the next day, the next challenge. I think that's part of life. You've got to, take each day as a new challenge, and there's no 2 days that are ever the same. And particularly in medicine, there are always unique challenges. In my job, every day is different. Every day is a unique set of challenges. But I love that. I love the challenges because I think the ultimate goal for the challenge and being successful in meeting the challenges is really providing patient care at the bedside. Even though I don't practice anymore, to me it's about quality and safety and talking to physicians and what we can do in terms of making them be better physicians. And I think that's come a long ways.
You're in a perfect position to do this now.
Thank you.
It's not, it's not easy to get into that position and your actual title, of course, you're Chief Medical Officer at Broward Health. And Broward Health is a huge organization.
It is. We're actually the 9th or 10th largest healthcare system in the United States. So there's an immense responsibility, and there's certainly a step up from my previous positions where I was chief medical officer in a hospital. Going from that to a systems level is going like from driving on the road to flying in a plane at about 10,000 feet. Just a whole huge number of unique challenges, but I love that. And I think we've made some tremendous strides. You know, despite the negative press that we've had over the last couple of years and with the unfortunate death of Dr. El-Sinati, you know, and some of the things that have happened, I really have confidence and see some really positive steps being taken by interim CEO. Bev Capasso actually was CEO at Cleveland Clinic in Weston and then also at Jackson. But she knows how to get things done. And I think unlike, you know, the other folks, she's really moving things forward. Not criticizing them because they were in interim positions and they were in difficult situations. But I really think that she said, you know, the buck stops here and I'm going to do whatever it takes as the interim until we can really get this stabilized. And I've already seen some huge steps. I mean, the first challenge is that with the decrease in the disproportionate share, we call it dish funding, and the low-income pool, you know, we found ourselves in a $50 million deficit this year. $50 million is a lot of money. But we're through cost containment, cutting, and not cutting positions at the bedside. We've all vowed, Bev and I both have said to each other, there's no positions that are going to be eliminated where patient care is involved. But there's support staff and folks at the corporate and the regional levels where, you know, somebody else could do the job just as well. 2 jobs that could be done by one person. In fact, I just had that conversation about one of the medical directors before I left. I said, if he can handle one hospital, he's got to be able to handle 2. So I think, you know, with those efforts, those efforts and some of the out-of-the-box thinking, and it's just been a pleasure to work with her, that we've really seen we're narrowing the gap. We're close to where we need to be. We're not quite there. I think we're about $5 to $7 million apart, but we're going to get there. And I think it's just going to, I think the fact that, you know, although hospitals, you know, are there to serve patients, and we'd all say that's the number one goal, in order to really survive and to continue to have capital improvements, you've got to make money. And, you know, we cannot just lean on the taxpayers for the money that they provide. And the taxpayers of Broward County are very generous in what they are able to provide and what they provide through the tax millage rate, which, by the way, I understand is either going to stay the same or actually decrease. So we're trying to decrease our dependency and really run Broward Health like a business so we can really have a break-even and a profit, so we can do some of the things that can add to the patient care capabilities, quality, and safety.
Because you just hit on it, Dr. Westphal, because if you can get the patients to do preventive health,
mm-hmm.
you'll have less people going into the hospital.
Exactly,
and I know
right.
that you have a lot of these programs going on at your hospitals.
Yeah. And we're really not there yet. I think one of the key concerns that I've always had as a physician, and us being a safety net hospital, has been related to taking care of the indigent and those that don't have or can't necessarily work or be able to provide funds for their health care, even have transportation. We really need to look at that vulnerable population. You know, South Florida has the largest homeless population in the United States. I think it's one of the largest. If it's not the largest, it's one of the largest. You think about it, people come to South Florida. You know, we have, unfortunately, a lot of veterans with PTSD, folks with mental illness. We have people just have fallen on hard times. But needless to say, we still need to provide a level of care, and it doesn't need to be in the emergency room. So that's one of the things we're really trying to work with Community Health Services and Broward Health Physician Group, which I now am the interim vice president for Broward Health Physician Services until we get a new director.
So
I've been in that position since January. It's very busy. So we're really looking to try to improve access to patients, allow them. One of the goals is to be able to allow them to schedule their appointments online and also to have a call center. So, you know, we don't think that patients necessarily need to always go to the emergency room. So we've prepared a flyer that we're going to be distributing in our Broward Health Physician Group offices that tell a patient what are the conditions where you can go to an urgent care center, what are the things that would really mandate you going to an emergency room. And it's not saying that they need to go to other one or the other. They just need to recognize where would be the most appropriate level of care.
Would that be appropriate for any place, not just the Broward Health? Because
Yes.
I would put that in Boomer Times.
Yeah, in fact,
think
it
it's
is, and
pretty
I would be glad
Yes.
to share that with you.
I
In
think
fact,
it sounds
we just
good.
had a meeting with one of the large managed care companies on Friday, and they themselves had not heard of this, and so I'm going to be sharing it. They're going to be putting it in their newsletter. So I've got your email address. If I don't, I'll get it, and I'll send that to you because I just got it a couple of days ago, because we want to make sure it's really for informational purposes for the patient, because, obviously their copay is going to be a lot less, or any kind of payment out of pocket is going to be a lot less if they go to an urgent care center versus an emergency room.
Well, we're very privileged to have Dr. Dan Westphal, who is the Senior Vice President and Chief Medical Officer of Broward Health, here talking with us. He really has so many other things to do, but hopefully some of the things he tells us will just make the difference. And you should really think about what he said with Broward Health. And I always say this, it's not really, even though I know you're in a management position, but you're also a physician, it's not what happens at the top. It's what happens in those hospital rooms and happens with the doctors. And I have not heard one negative thing about any of your doctors. So, and just going into now the pediatric, the new pediatric center, what you have done there is just, I just couldn't believe it. It's amazing. So no matter what has happened, at the top, and this one resigns or something, you have been able to keep the fires burning where they're supposed to be.
Well, and that's true, and it's really, as you said, it's really about providing care at the bedside. It's the bedside support. We're all there to support people taking care of patients at the bedside. And I remind all of our management groups about that, because, it's not, you're not here because of me, you're not here because of our CEO or the board or the hospital administration, nurses or doctors. You're here because you're a patient, and that's who the focus should be, and should be the emphasis. And that's why all of our support needs to be directed toward that bedside level of care.
So, could you just do it in a few words, not maybe a few sentences, what that information's going to say? When should someone go to the emergency room? When should someone just go to a care, just emergency care?
Well, when you have a cut, a bruise, a sunburn, those are the kinds of things, headaches, back pain. Normally, you should go to an urgent care center. If you're having chest pain, if you're vomiting blood or coughing blood, then those are the kind of conditions where they would really require, or perhaps you have blood in your stool, those things, particularly if it's bright red blood, would really demand you to go to the emergency room. But those are some of the things. Even a broken bone, sometimes those things can be, if it's not a displaced fracture, they can be taken care of in an urgent care center. We're trying to, again, Anita, to get back to the level of care that's appropriate for the patient's needs. And we know sometimes the waits in the emergency room are long, and the waits in the urgent care centers are much shorter. So I think it's important. We want to provide, again, a level of care that's appropriate to the particular medical condition the patient might be suffering.
Right, and I think the care centers know if it's just not appropriate, they will send you to a hospital, will they not?
Yes, correct. That's exactly right. And we actually had that discussion this morning. I was talking with someone who runs our Weston Urgent Care Center, and I was talking about, the most important thing is not just taking care of the patient, but being able to have the judgment, to be able to recognize conditions that would really dictate a person going to the emergency room, whether that's an ARNP or whether that's a physician. In the final analysis, what doctors really, you depend on them for is their judgment. With all the years of knowledge and experience, you really are looking to them for their judgment and their decision-making ability, because that can only come through training and experience. Hopefully, there are some people that don't get it, but I think, with the kind of facilities we have at Broward Health, that's not really been an issue for us. I think we really have, right? In fact, what usually happens is the opposite. Most patients will go to the emergency room instead of the urgent care center, and, that's much more expensive. There's a higher copay. They have a longer wait. And if they have truly an emergency, they're going to get right in. But, things like cuts, sunburns, and things like that can easily be managed in an urgent care center.
And once you go to the emergency room, they're not going to send you to pretty much.
They're not going to send you back to an urgent care center. They're going to take care of you.
Yeah, and you're right. And it should be safe for people who really have big problems. because I have one of my staff members who lives down in Miami-Dade, and he got his hand swelled up horribly. He must have been bitten. And so he wound up, I guess, going to a hospital down in South Miami somewhere. And he was there all day. And he finally got antibiotics. And I don't know what they did for testing, but would that have been appropriate for him to have gone to a hospital?
Yeah, I think having a hand swelling or things like that, unless there's any compromise of circulation where your fingers are getting blue, which would be very rare, then if they were getting blue or they were numb, then that would be a reason. But just for hand swelling, urgent care center could have taken care of that in a fraction of the time.
Is there a doctor at an urgent care center, or is it who is there?
Well, actually, we've changed our model a little bit in our urgent care centers because we find that the vast majority of cases can be handled by an experienced ARNP.
Which is
so,
what?
An advanced registered practice nurse.
Thank you.
They actually have a higher level of training, and many of them have the clinical skills to take care of these kinds of problems, to treat. They can prescribe, and they'd still work under the jurisdiction of a physician, but the physician doesn't have to be on site signing all the different orders and so forth like they do in the hospital.
Yeah, so that's very good news. And the other part about all that is, you're right, once they go to a hospital, there are germs, there are a lot of things there that
Some
that
bad
happen.
things can happen. People go to the hospital, you can stay too long, you get sick. It's true.
Well,
You can fall, you can have an infection, and that's why we try to keep people out of the hospital as best we can and get them discharged timely and appropriately.
So I do have a question. Now, I live up in Palm Beach County, but if I want to go to a hospital, I want to go down to Broward Health, Imperial Point. Sorry. I know a lot of the other ones down there, but I know, everyone there. What happens with the ambulance? Do I tell them that's where I want to go? I don't know how that works.
Well, it depends. Sometimes, depending on a condition, if it's a 911 call, they'll take you to the nearest hospital. The problem is if you call the ambulance, sometimes you might be responsible for paying the bill, particularly if you're being transported a longer distance. But there is some liability with the ambulance, the EMS, by not taking patients to the nearest facility, and that's what they really should do. I mean, even though the nearest facility is not Broward Health,
that's right.
You still, I think that's the best, because certainly you wouldn't want to have an emergency situation where in an ambulance you'd want to be in the emergency room. If that's 5 minutes away versus a half hour, we'd prefer you coming to Broward Health, but realistically, you should go to the nearest hospital where they take you.
Okay, now maybe why don't we talk a little bit about the great things that are going to happen at Broward North, which is fabulous.
Well, the new neuro center is very exciting. And the new emergency room, which you've probably seen, is just fantastic. It's really state-of-the-art, and it's the nicest emergency room, truly, I've ever seen. I used to run an emergency room, worked in a lot of emergency rooms in my training, and, during the time I was in the Army and during the time that I was in residency and fellowship, so I had an opportunity to see a lot of emergency rooms. But it truly, with the space, the capability, they have special trauma rooms because Broward Health North is a level 2 trauma center, and they can pretty much deal just with about everything. And of course, I'm partial because that's where I practiced, was Broward Health North. So, I always think that they do an excellent job, which they do, as do the other district hospitals, because I've spent a lot of time in all of them, since I've been in this position. So,
well, yeah, they're a little quiet. See, Broward Health North, I have always, that's the hospital I've done a lot of things with. I knew the CEO who was there for so long and all that. But now it seems like they're just pumping up. And now we're going to get this big neuro center and then, of course, the emergency room. That's what makes it, you were saying, what makes it so great? Do they have different kind of equipment? Or
what makes it great is the people.
What?
No, the people that work there are what make it great. It just can't be the facility. The nurses and doctors, there are people that are still working there that were there when I was in practice, and I haven't practiced for 19 years. So that's since 98. So there's just, there's a tremendous esprit de corps. I mean, there's a real allegiance to the facility, and I think that's true for all the Broward facilities. They might be able to, some of the employees might be able to go and make more money, but I think, the camaraderie and the relationships and, the patient population really keep people there.
As a board member of the Broward Health Foundation, when do we get, did they already have a viewing? I don't think I had a tour yet.
Well, they did for the emergency room, but I don't think they have yet for the neuro center.
Well, that's not quite finished.
No, it's not
really.
Quite done. They're working on it. It looks close, but I don't think it's quite done.
Yeah, and so Well, that's super because I know that there are. I mean, I'll just say this: that of course they have the one in Boca, which I know, and I've toured that, and I've always wondered why we didn't have more in Broward Health, but it was always money.
Always money.
Same thing now. We do need donors, and I have to say that to everybody. A lot of you have made your wills, and you probably don't like your children. You don't want to leave the money to them anyway. And Broward Health is, I know, I'm laughing, but how many stories I hear all the time. But it's a wonderful way. The Broward Health Foundation, they have various ways to leave money, and you don't have to give it right now. You just leave it in your will, or you can give some money. So I really, just go to browardhealth.org. And
you make a good point, because last year we raised all $20 million with the assistance of the Sala Foundation, through the board. So we matched the $10 million, they matched the other 10. So the Sala Children's Foundation and the hospital, not only at Broward Health Medical Center, but Coral Springs. I was out there for the dedication. Absolutely incredible. Then with all the new building program out at Coral Springs, it's pretty exciting with the labor and delivery rooms and pediatric floors that they've got going up out there.
Yeah, they and also they have such a large now population that and it's growing with families,
that's the demographic. That's where Broward County, you can see the fastest growth. In fact, we just met with a company about 6 months ago, and they showed the demographic is really, it's like red hot in that area. So, that's going to be very important to make a strong presence. One of the things, too, that we're looking at, I think is in 2019, is having the ability to do cardiac catheterizations at Broward Health Coral Springs. We do cardiac catheterizations at the other 3 hospitals, but this will be the last one.
Oh, and they don't do it there? And
don't do it there.
Why do they not do that?
Well, I think it's just because that was never thought of. That's our newest hospital, and I think now that we've seen some of the competitors and so forth, we know that the population will support that. And we're actually looking at staffing up some of our employed cardiologists to go out there in the next 1 to 2 years. So that's exciting. So,
well, and you really then are on the cutting edge of a lot of things, aren't you? And you keep looking for more. And of course, you're doing, there's robotic. I just interviewed someone from you who's doing the robotic surgery.
Yes.
Which is very important now. And I don't know how much robotics are going to continue. Not that they're going to continue. Where else are going to be able to have robotic surgery? Right now, it's just limited to certain things.
Yes, a lot of it's limited to GYN procedures and also to general surgical procedures. They're also, I think, starting to do orthopedic procedures as well. So it's kind of exciting to see that. But who knows? Who knows? The sky's the limit. As the technology improves, who knows what's going to be next? You just don't know.
Well, right. I just heard, Elon Musk I just heard a whole thing on NPR with Elon Musk and what he's doing. At least he's keeping it to cars. He hasn't gotten into medical stuff yet. But do you have a hero?
Have a hero?
Yeah.
I've got several.
Okay.
I've got several here. My first hero is my grandmother, my maternal grandmother.
Why? I knew your mother was important. Why was your maternal grandmother?
Well, my maternal grandmother was very important because she actually was a pioneer woman and lived in a sod house on the prairie. You saw the little house on the prairie. She actually lived in a sod house in the Midwest they called it the Great American Desert because there had been a widespread drought there for many years. So there wasn't a lot of wood, so they actually lived underground, lived in a dugout. And if you think about the Midwest, how hot it can get, that's the only cool place you could find would be. But she, my understanding from her description and from my other relatives' description is that everything was spick and span. She had hand-woven rugs on the floors, and it was just like home. So she grew up in the 1870s, 1880s.
And the children, your mother, lived there?
Not in the sod house. She came along a little later, but her 3 oldest siblings did. And so my grandmother still remembered, the Native Americans and how she felt sorry for them and how she would give them food. And so she was really she was very resilient. She was a very resilient woman, and she was not afraid of anybody, but very loving, kind, and she took after her mother. And her mother was they were midwives. So they actually did in some ways practice medicine because back in those days, they didn't have a lot of doctors, So they would have a midwife. The midwife really was someone who was a nurse and also did house cleaning and laundry and kind of went in and took care of people who were ill for a while. So, and her mother had done that too.
So that is
that's kind of where the interest in medicine has come, I think.
I think so. Yes, but and just going back to the sod house, are there any pictures of houses like that? I guess I can find them on the internet. There are a few.
Yeah, you can find them on the internet. There are a few.
Look at one.
In fact, I saw one. There's one. I'm trying to think where it was in Kansas a number of years ago, and I actually saw it. And they actually showed what it looked like.
I guess it's really very similar to what an Eskimo lives in.
Well, it would be. It's just underground. Yeah, it's just covered with.
Right.
But
with
the thing
ice.
is covered with grass.
Oh.
You know, it's covered with grass, and they go in and they hollow it out. It's kind of like into a little hillside usually, and then they fit it with. I don't know how they fit the door. I don't remember how that was. It might have been like a sheet or something over the door. But
very
interesting.
It's
very interesting. So she's my hero.
That was your hero.
Yeah.
So do you have one more?
And one more. That was the late Dr. Malin Delp. He was chief of medicine at Kansas when I was there, and he was a phenomenal clinician. And I was actually on his service and got to know him really well. And he's been deceased for a number of years, but he actually was a tall man with white hair and a handlebar mustache. But he had very leathery skin like the Native Americans, because he was part Native American, very leathered skin, weathered, but he had these cold, piercing, gray-blue eyes. And when he looked at you, they would go right through you, particularly if you didn't do anything right.
Yeah.
But I never got that look.
No,
so
I'm sure. Well, this has been just absolutely wonderful. I know there's so much more to you than just that's why I love to get you here on my radio show. Thank you very much, and we'll just keep supporting whatever we can at Broward Health.
Invite me back. I'll be glad to fill you in on part 2 and part 3.
Right.
Thank you, Anita. Appreciate it.